So hello everyone, my name is Jonathan Clavell. I'm a private practice urologist in Houston. I focus in men's health and sexual medicine. And I'm here today with my very good friend, Matt Ziegelmann. Matt, introduce yourself.
All right, hi Jonathan, thanks so much. So my name is Matt Ziegelmann. I am the membership committee chair for the SMSNA and a member at large on the board of directors. And I practice sexual health at Mayo Clinic in Rochester, Minnesota.
Right, you can be a little more informal with that. He is the Peyronie's expert, which we're going to be talking about today. He is the Peyronie's expert at Mayo Clinic. So, Matt, we have this session right now. We want to talk about research studies and research studies that probably people don't have the time to read. And we're going to analyze an article. And there's this article that was published last year, right? And you had a really good critique to it afterwards. And it was an article looking specifically at the use of a daily low-dose Tadalafil, a medication that we well know that we well use it all the time to treat both lower urinary tract symptoms after BPH and also erectile dysfunction. And there's this article that was looking into using this medication during the acute phase for Peyronie's disease. And basically this was a retrospective single institutional analysis. They looked at 191 men who were within the acute phase, and they stratified them between those that were taking daily Tadalafil versus those that were not taking daily Tadalafil, and they followed these patients for 12 weeks, correct?
You got it.
And then they were looking at the progression of the curvature. Were men taking the Tadalafil able to progress less than those who were not taking it, correct?
Yeah, that is exactly right.
And their outcomes, do you remember the outcomes? Like what did they show?
Yeah, I mean, what they were trying to see is, does using Tadalafil to treat Peyronie's disease in the acute phase prevent progression and potentially even improve the curvature? And they did find, now this was a retrospective series, right? Mm-hmm. So this included a chart analysis of a single institution. Mm-hmm. I think it was a single provider as well.
That's correct.
And they wanted to look at, after this 3-month course of Tadalafil, what happened. So there was a statistically significant difference in the likelihood of progression, so of a worse curve after that 3 months of therapy.
If you were not taking the daily
Correct,
Tadalafil.
so it was favoring the Tadalafil.
Mm-hmm.
So the patients who took the Tadalafil essentially had very little curve on average, mm-hmm. and the likelihood of progression was around 25%, mm-hmm. as opposed to about 40% in those who did not take the daily Tadalafil.
Which again, I mean, if we talk about the theoretical aspect behind this, again, with this medication, we're dilating blood vessels, we're delivering more oxygen to the tissues. Therefore, things should stay healthier, and we can possibly prevent that scar tissue from forming. Yeah,
the idea, at least the way I counsel patients, is protecting the penis, right? So mm-hmm. you're promoting stronger erections, you're preventing that repetitive trauma to the penis during sexual intercourse with a soft erection. But there's probably more to it too. This is a couple decades now where they've looked at the mechanism of PDE5 inhibitors, which mm-hmm. is what Tadalafil is, mm-hmm. and it actually can modulate scar tissue formation. It can affect those various inflammatory and profibrotic cascades mm-hmm. in animal models, and so you can sort of extrapolate that. Does that work at a human level, right? And so that's the theory here. That's the hypothesis. In addition to causing stronger erections, it's actually preventing that profibrotic milieu.
The other thing that they also found in this study was that the mean IIEF scores and also the PDQ scores were actually higher on Tadalafil group, which again is expected if we're giving a medication that will also enhance their erection. Most importantly, again, you did an analysis of this article, because again, it looks promising, but we still cannot consider this as scripture, because again, there are things that we have to also consider. Tell me about those.
So this was published in IJIR, International Journal of Impotence Research, and they asked me to do a review of the article, essentially a commentary. So great, like innovative data, exciting. What we're seeing in practice, I mean, I've been using this mm-hmm. well before I reviewed this article, but the idea here is how strong is this level of evidence, and I would say not very strong, right? It's a retrospective series, single institution, relatively small cohort. Patients weren't weren't randomized to one treatment versus another. They self-selected essentially. There were a couple other things. So they were looking at the acute phase of Peyronie's disease. And what defines the acute phase of Peyronie's disease is not entirely clear.
That's right.
So I think the average duration of symptoms was 10 months. So one of the questions is are most of those guys actually in the acute phase of PD, or are we looking at a chronic stable phase?
Right.
So they did do analysis. They did a sub-analysis looking at less than 9 months versus greater than 9 months, and it seemed to have the greatest benefit in patients who were less than 9 months out from symptom onset. So suggesting that the acute phase is probably where you're getting your most bang for your buck, which is what most people who have historically prescribed oral therapies were doing. They were using this in the acute phase when that scar tissue is setting in.
And last but not least, this was also a single institution analysis, right?
Absolutely.
Everything was done by a single surgeon. So we also have to take that into consideration. Was there a level of bias when it comes to a study like this? But again, it is still a very promising study,
absolutely,
right? This is something that we've been prescribing, as experts, we've been prescribing this. It's really good that we can finally have some data, at least something to support, what we've been doing.
Yeah.
Again, I know you agree, at least somewhat agree with me. Again, should we already start putting this Tadalafil medication in water?
We call it vitamin C. Like at our, we prescribe it so often as vitamin C, Cialis for the trade name, but. I think there's a ton of utility in these types of medications beyond the erectile dysfunction and lower urinary tract symptoms, and this is one example of a potential utility.
Well, great. Well, thank you for for being here with us today.
My pleasure.
Thank you to the social media committee of the SMSNA, and again, hopefully we can do this again at some time. Again, it's always a pleasure and an honor to be sharing such a platform with you.
I agree 100%. Please become a member of SMSNA if you're not already one. Go to the website and click on the membership link to learn more.